I was born in Moncton, New Brunswick.
I was born, raised, and I live in Toronto.
I was born in Saigon, Vietnam.
I live in Essex, Ontario.
Campbellville, Ontario.
I'm from Toronto.
In April of 2014, I was diagnosed with uterine cancer.
I'm actually of an Aboriginal background. My dad is Native American.
I'm a caregiver for my mom, and she has vascular dementia.
My mother was diagnosed with acute myeloid leukemia.
I'm a person living with mental illness and addiction.
Personally, I try to stay away from hospitals.
I had a 23-year drug addiction. I've been clean 15 years.
Quality healthcare is treating people like people.
Something that everybody can access.
Did they correctly diagnose what you have? Did they fix your problem?
You have this system of people who all have a different expertise, and it's finding a way for all of them to communicate with one another.
There I am, laying in a hospital bed, extremely upset. And the nurses, noticed that it was my birthday, and being since I couldn't eat or drink anything in case they had to operate, they took a little cup of ice chips, put a candle in it, everyone saying happy birthday, and that just kind of made me realize that they actually cared about me and not just their job.
Oh, I had surgery. I had a radical hysterectomy. And she said to me, if she needs to take more then. I said, you know what? You're the doctor. You know what you want. I said, the store's closed now, so if you want it, you just go ahead and take it. It was two weeks from start to finish that I found out I had cancer, it was dealt with, and it was totally gone.
I met one nurse who took the time to ask me how I was feeling and just assured me that it was quite natural to be worried and afraid, and that they had an excellent team there and they would do everything that they could to make me feel comfortable and to help my healing process while I was there.
I think this doctor clearly knew that his strength was communication and building a rapport with patients, and he came in one day, no rush, and sat down to explain what leukemia was, the particular type of leukemia that my mother had was. It's like a metaphor, which is that her marrow, her bone marrow was like a field, this beautiful landscape of grass that had now filled with weeds, and it needed to be cleansed and cleared. But unfortunately, in the process of doing that, you need to clear all the grass, everything. And it'll be barren for a while, but then that's only so that the grass can return weedless. And that conversation existed in the context of him asking questions about the family, how we were dealing with it.
It was a new hospital, I didn't know where to go. When I stopped to ask staff or volunteers, where should I be going? The response was, it's not my job, ask someone else. And no one returned a smile or said hello, and so it was a bit difficult.
And I brought my mom to the doctor, but her family doctor was on vacation, so brought her into a walk-in clinic, and they told me she needs to be in the hospital right now. You have to bring her to the ER if you have to. So I listened to the doctor, bring her to the ER. And after the triage, she said we had to wait. And then that was 2 o'clock in the afternoon, and we waited until 11 p.m. And they said, oh, sorry, why don't you go home and come back tomorrow? We couldn't, she had to get an CAT scan, whatever, on x-ray, but we can't fit you in. So come back tomorrow, first thing in the morning, 9 o'clock. So come back 9, and then after the waiting longer, when we got the x-rays, oh, you know what, we should get your CAT scan, but you have to wait. And
my father had a bit of a sniffle. I think he was having some allergies. This had been in the first month of her treatment. And a nurse had noticed that and said, are you feeling okay, to my father? And my father said, yeah, I'm okay, and I'm just here to see my wife, but just a bit of a sniffle. Is that an issue? And the nurse became really stern with my father, actually got upset with him, saying, well, you're not allowed in here then. And my father asked, what do you mean I'm not allowed in? And she said, you're putting everyone on this floor at risk if you walk in, and that's totally unacceptable, and I can't let you in. I wouldn't be doing my job. And which is fine. I mean, you know, it is true. But I remember watching my father as he, you know, shook his head, walked away, and he like broke down crying, you know, because his wife is dying, and this nurse, while doing her job, could have delivered, I think, that in a much more empathetic and compassionate way.
They sent me home even though my vertigo was so bad I couldn't stand up. It was hard sitting in a wheelchair and being moved. And my husband is there trying to take me out of the hospital, and I'm retching into a bag because I felt so nauseous. And I felt that the system abandoned me at that point, that I was just a case number. And what I was going through didn't matter to anyone.
I was given insulin, and I thought, again, I was covered until I went to use the insulin. It's an insulin pen, and the insulin is in the pen, and the screw-on needle has to go on the top, and I'm on disability. The insulin is covered. The screw-on needle is not. I was able to get the one box. I can't tell you how many needles were in it, but what happened is I've made them last over 2 years by using one needle. You're supposed to use one needle per injection and then change it. And I've been using one needle per insulin pen, which comes out to be about 10 injections.
Quality healthcare is good and proper communication.
Really getting to know your patient, listening to them.
Quality is being treated for what I need to be treated for properly, like a human being.
There's a human touch.
It's not just about addressing my physical safety, but it's also about addressing my emotional and my psychological safety.
Putting yourself in the patient and family shoes, and you know, see it in their perspective.
Quality.
Quality matters.
Quality matters.
Quality matters.
Quality matters.
Okay. All right, good.
Cut. Go back.